So we are set.
All right, sir.
Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. These are the speaking sessions. Role play number 1, insulin injections. At practice with Peter, the English language doctor. This is the role player card number 1 for nursing profession. This is the card for the role player. That means the patient. That means I, the interlocutor. This is for me. And this is the role play card for the nurse. So you have prepared this card well, right, Jennifer?
Yes, sir.
Okay, you have to talk a little loudly, okay?
Okay,
right.
sir.
So we have here the one-on-one role play, which we are going to start now.
Okay, sir.
Hello, Jennifer. This is Jennifer Chinelo from Onitsha, Anambra, Nigeria. This is speaking role play number 1, insulin injections. Hello, Jennifer. Are you ready?
I'm ready, sir.
Yes. Speaking role play number 1, diabetes, insulin injections. Yes, you can start.
Okay. Good morning. My name is not Jennifer. I have been sent by the GP to come and teach you how to give injection. Please, for the purpose of clarification, how may I address you?
Yes, you can call me Lincoln because my name is Abraham Lincoln.
All right, Mr. Lincoln. How are you today?
Yeah, I'm fine. Everything is good. What's wrong with me?
You are in a safe hand, Mr. Lincoln. Like I told you, your GP sent me to come and teach you how to take your insulin injection. I learned that you have been controlling your diabetes with diet and drug, right?
Yes, nurse, of course, absolutely fine. I'm going on with my medication diet and exercise regimen and then the medication program. Everything is fine. I have been managing my diabetes perfectly fine. Then what is wrong with this doctor? Why does he want me to change the treatment plan?
Nice, Mr. Lincoln. I know that you have been managing your diabetes with diet and medication, but as you can see, your sugar level is high. And this time, your diet and medication cannot control your sugar level anymore. So you need an insulin injection so that it can be controlled. Did you get me?
Yes, of course, but I want to ask you if there is any other way to manage my diabetes because I'm scared of these injections. I don't want. So kindly let me know, nurse, if there is any other possibility.
Oh, Mr. Lincoln, I completely understand how you feel. If I am in your shoe, I will feel the same. But I want to assure you that you are in a safe hand. You have been managing it with diet and medication, and it's still high. This time around, there is no other way you can manage it if not with this insulin injection. You can still control your diet, what you eat, and also do a little exercise, but you still need the insulin injection to get your sugar level down, at least for the level that will be appreciated. Did you get me?
Yes, of course, nurse. I do understand. But if there is no other possible option, then you can explain me the procedure of taking the insulin injections.
Thank you for requesting for that, Mr. Lincoln. Okay, here I'm going to a procedure will be as follows. Firstly, you have to get a clean needle, specially made for the insulin injection. It's not like other needle. It's always calibrated from 5 to 100 international units, or it can come with 10 to 40 international units. So a sterile needle will be provided. Then once the needle is available, you clean the sites of the injection, either your thigh, upper part of your thigh, or upper part of your arm. You clean it with a cotton wool, spirit cotton wool soaked in spirit or in clean water, sterile water. Then after that, you pinch your skin and place the needle at angle 45 degree. Once you insert the needle, you release the pinched skin, then push in the insulin. Leave the needle for about 5 seconds. Gently press the injected side and remove the syringe after the 5 seconds. Do not massage. Don't worry, blood will not come out. Just leave the site clean. Did you understand this procedure well?
Yes, of course, nurse. But should I change the place of taking the injection? And what about the injections? So, okay, should I take the injection same place every day?
You take the injection according to the anyway, the dosage of to be taken depends on the level of your sugar. Sometimes you will check the sugar, you will check the glucose level, it will be high. That is when you will take the insulin injection. But if it is within the normal range or low, you don't need to take the insulin injection. And there are sites specifically made for the injection. Like I said earlier, the upper part of your thigh and the upper part of your arm, either left or right of any of these sites. Is it okay by you?
Yes, nurse, definitely I will do that. But I want to ask you one question.
All
So
right, go ahead.
you are asking me to take these insulin injections on my own. Okay, how is that possible? If anything goes wrong, then what will I do? And I want to know if there will be any side effects of insulin injections.
Thank you for asking this question, Mr. Lincoln. The only possible side effect of taking this injection is hypoglycemia. What I mean by hypoglycemia is that your sugar level will go down, and it can only happen if you did not eat. So you have to take this injection. Once you take it, you wait for about 30 minutes. After 30 minutes, you can eat your food. And there is a need that you eat something after 30 minutes after the injection. But if you do not eat anything, hypoglycemia may occur. And if there is anything like that, should anything like that occur, you call the helpline immediately, or you tell anybody around you to call the helpline. Secondly, I will always check on you to monitor to know how you feel. Is that okay by you?
That's very nice, nurse. And I want to ask you regarding the used syringes. Can I use them again or should I throw them off?
Thank you for this wonderful question, Mr. Lincoln. A safety box will be provided for you. That is where you are going to put the used injection. You don't use syringe. You don't need to use it twice. Once you use, you put it inside the safety box. Did you understand me?
Yes, nurse. Of course. And fine. What about the used syringes? Can I use them again, or should I throw them off?
Okay, Mr. Lincoln, you are not going to use the syringes again. Like I said earlier, a safety box will be provided for you. That is where you're going to put the used syringe. You use once and throw away. Is that okay
Right.
by you?
That's very nice, nurse. Thank you very much. Is there anything else that I should know?
For now, Mr. Lincoln, there is no other information, but should you need further information, you can contact me. A number will be dropped for you where you can contact any of us, either your GP or I, if you have any other worries. Did you agree with me?
Yes, nurse. Thank you very much. That was nice
Okay,
talking
Mr.
to you. You
Lin.
have given a lot of wonderful information. Thank you once again.
All right, Mr. Lincoln. Take care of yourself.
Thank you, nurse. Thank you very, very much. Have a nice day.